Namaste, welcome to Ayur Bodha. Myself, Dr. Mahesh Savalagimath. So today we are going to discuss about yoga. What is yoga actually? In Shamana while prescribing Shamana what is the meaning of yoga? Many times we hear the word yoga, right? One quotation is very famous. We all have studied this, right? Hope you too have studied. Yoga the piyusham tekshnam vesham uttamam bhavet. Right? Tekshnam uttamam vesham bhavet. Veshaschapi duryuktam tekshnam sampadate visham. Right? What it means, what we have understood it is like if a medicine, if a poison, even if it is a poison, if it is used correctly, then it can act as a very potent Veshaja, that is Aushadha medicine. Similarly, if a good quality medicine, it's a best medicine, if it is not used correctly, it may prove fatal or it may act as Visha, right? So this is what overall we consider. Now, what is the correct use? What is the meaning of that correct use? What is that word in this shloka? It is explained. It is actually before this also 4-5 shlokas yoga with like that. Acharya has explained a lot about yoga. Word yoga is many times it is used. It is in Charak Sutras and first chapter, right? So, what is the meaning of yoga? We need to understand that, right? Yesterday we were in last video we discussed about some of the principles of effective prescription of medicine, right? So it is also in connection with that, where in that we studied Purusha Bala, Agni Bala, and Roga Bala, right? These three we studied. Now, this also includes that. So, what is yoga? Acharya Chakrapani very nicely he says, Yogo Vyadi Shariradapeksha Samyak Yojana Beshajasya. But he says, Vyadi Shariradi Apeksha Samyak Yojana Beshajasya. Vyadi Apeksha Sharira Apeksha, Adi Apeksha. Apeksha means what? That disease, Vyadi Apeksha means disease is, hoping for something. Like body is hoping for something at a condition where a person is suffering from some disease, right? So that disease is anticipating something to repair it, right? The body is trying to, it's anticipating something. So Apeksha matlab in relation with that or what is needed for that condition, right? That. Next is Sharira. What is the Prakriti of the person? What is the Vaya of the person? All those things, dosha and all. All these come under Sharira. Apeksha means considering this, examining, assessing the disease. Next is the Sharira. Adi. What is Adi? I'll just give an example. For example, in one of my presentations, one of the doctor he I think he learned about Patala Muladi, where in that presentation I was discussing about use of Patala Muladi. It's very effective in the management of Shita Pitta, right? So if we use it in on empty stomach, it causes little pain abdomen and loose motion will be there like that. So he understood that and he gave that medicine to the patient, to his patient when he come across with a Shita Pitta patient. Full week, patient was advised that still patient had severe pain abdomen, but there was not a single loose stool, like single time loose motion. Not a single, what you can call Nitya Virechana type Vega, not at all. And the condition got that itching, Shita Pitta was not reduced, it was increasing. Then that doctor called me. Sir, you told like Patalumuladi, if you give, it will cause loose motions, there will be the little pain abdomen, and then it causes loose motion. But in my patient, where I prescribed it, it has caused severe pain abdomen, but not a single time loose motion. I thought like two things may be there. One is the patient may be having Krura Kosta, right? If Krura Kosta is there, at that time, if we give Patalamuladi, it causes pain abdomen, but it will not lead to loose motions because Kosta is Ruksha. Ruksha Kosta or Krura Kosta, you consider both. If Kosta is Ruksha, at that time, already Kashaya, which is Ruksha, right? It will not make the stool soft, right? It has to make stool soft and then it will throw out. That is not possible. Secretions are not there in the, lower GI. So that may be one. Second one is Desha. So I asked him first, sir, where you are practicing? He said like, Guntur or something. And if I'm sure it's Guntur or something like that. So I asked it what type of Desha it is. It is Jangala Desha. Now, Adi includes Desha also. So in Jangala Desha, if you are giving Patalamuladi Kashaya, it will not cause loose motion. Because already Jangala Desha, Vata Bhuishta. So what you have to do, if it is not causing loose motion, What do you have to do? We have to do Snehana. So what I suggested him, sir, you do one thing. Morning you give 1 teaspoon Tiktagrata. Evening you give Patalumuladi. Second day onwards, patient started having 3 to 4 times loose motions in a week. Patient was, along with that, I asked him to prescribe Dushi Vishari also. So in just a week time, patient became completely free from urticaria and that itching and all. So this Adi includes this also, Desha, right? Posta, right? Condition of the posta. All these things, when we assess all these things and prescribe medicine, then that is called as yoga. Yoga Vyadi, Shariradi, Apeksha, Samyak Yojana Beshajasya. Samyak Prayoga. See, many times I have told in presentations and I have told like, what is the ultimate goal of BMS? What should be the aim of BMS? It is Samyak Prayogam Beshajasya. If a student is able to prescribe Samyak Beshaja at the end of the BMS, that we can say that we have achieved our mission of creating new doctors, like creating new generation of Ayurveda, right? So that is very important. So for this, we need to be always, it's very essential, we need to be learning, we need to be updating ourselves. See, Acharya Charaka in same chapter, 133, what he says, Vishak Mumurshur Matiman, विषग मुमुर्षुर मतिमान अथ स्वगुण संपत्ति परम प्रयत्नम आतिष्ठेत प्राणदा स्याद्यता नाम. विषग मुमुर्षुन मतलब मुमुर्षा मतलब confusion sometimes, that or doubt. Even a person who is so expert, who has lots of experience, such Vaidya can also sometimes get confusions, doubts while prescribing medicines or diagnosis or assessment of these Desha, Dosha, Kala, Prakriti, Matra, all those things. So that is why what he says, Swaguna Sampaddihi Param Prayatnam Matistate, for improving own qualities. We can say Swaguna Sampaddi means all the gunas, like it can be knowledge, it can be skills, communication skills, like educating the patient, all those things. Whatever is needed for successfully running a clinic with successful outcomes. So all those things come under the category of that Swaguna Sampatti. So what Acharya say, Param Prayatnam Matistate, maximum effort. When anybody, if he or she want to call himself or herself as Pranada, right? Prana Visara Vaidya, then should focus on always improving one's own qualities, like knowledge and skills. So if you want to improve your knowledge and skills, like do Swaguna Sampatti, then you can join our 50 hours online dermatology course, but it is only for dermatology, and that too restricted to two main conditions, right? It is a 50 hours online dermatology course package. In that, 30 hours is psoriasis management mastery, and the remaining 20 hours is dermatological manifestations due to Visha. See, many times people have asked me what actually it contains. So I just want to brief about what it contains. See, 30 hours psoriasis management mastery, it contains some 5 or 6 sections we can call. The first one is basics of psoriasis, where etiopathogenesis, understanding etiopathogenesis as per Ayurveda, and understanding Samprapti for planning treatment. First, dosha assessment of psoriasis, all types of psoriasis, dosha assessment, and differential diagnosis of the psoriasis. This is one. Next is management of all types of psoriasis. Management of all types of psoriasis, but in that I have added some 5 particular types of psoriasis, which I have seen as most common presentations in finger practice. The first one is scaling and erythema dominant psoriasis, management of itching dominant psoriasis, management of irritation dominant psoriasis, management of hardness dominant psoriasis, management of stress dominant psoriasis, erythrodermic psoriasis, scalp psoriasis, palmoplantar psoriasis. And the very important is, when you are managing any type of these psoriasis, whether itching dominant, erythema dominant, hardness dominant, or whatever it is, at one time they come to a same common stage, right? At that time we need to change the treatment. So management of that common stage of the psoriasis. Next, it contains how to prevent the recurrence, prevention of recurrence of psoriasis, effective selection of kashayas, churnas, gritas, and tailas, and shodhana in psoriasis. Most often people ask, like, we don't have panchakarma setup, and no need. Like OPD based shodhana, how best we can do, like, particularly virechana, how we can use the feasibly, as per the feasibility of the patient. I have given some 3 types of Shodhana, Virechana, which I practice, that I have explained, and very importantly, patient education, Pathya. All these are covered in this 30 hours psoriasis management mastery. Now, what that remaining 20 hours contains, it is dermatological manifestations due to Visha. We call it as toxicodermatology. It includes contact dermatitis, particularly allergic contact dermatitis, allergic skin disease like the detail it is like discussed, and some common cases which we come across like footwear dermatitis, gel or medicine, local medical topicals induced allergies, cosmetics allergy, jewelry allergy, soap allergy, plants allergy, drug induced allergy, textile allergy, so many, all types of food allergy, all types of allergic skin manifestations. Skin disease due to Dushivisha and Garavisha, where like atopic dermatitis we consider as due to Dushivisha, atopic dermatitis, psoriasis due to pesticides, chemo-induced skin diseases, Dress syndrome, it's a drug-induced skin disease, Darius disease, erythema multiforme, all types of occupational diseases. Such type of cases are clearly elaborately discussed. And the last one is skin disease due to bites and stings. Now, bites and stings, many times people say in our area bites and stings are not seen, no problem. It is not just management of bites and stings, application of management of Visha Chikitsa, the Kita Visha Chikitsa in dermatology, that is very important in this. That comes like conditions like cellulitis, vascular conditions, post-herpetic neuralgia, herpes, like so many, like leukocytoclastic vasculitis. Such bites and stings induced conditions are mimicking these type of dermatological manifestations, and also how to use keto chikitsa in managing general skin diseases. That also is there in that. Okay, so all this together is the price is 7,000 rupees, but don't worry, you can get 700 rupees discount. Only for those who are watching this video. If you use YT700 promo code, if you apply that one, and you will get 700 rupees discount. So it is 6,300 rupees. It is lifetime. You will get lifetime access. It's completely pre-recorded, anytime, anywhere, as many times as possible you can watch. And language is very simple. Like if you are understanding me in this video, then 100% you will understand the course. So we have periodic live sessions where question answers we do, and that's it. So don't lose the opportunity. I will give the link in the description or somewhere, or you can directly go to ayurvedicskills.com, and from there you can join. We have even installment of options also. Like if you go for installment options, 2 installments, you can join into easy installments, 3,500, where there is no discount. In that promo code is not applicable, right? Hope you understood what we discussed, like yoga. So while practicing Ayurveda, keeping simple things as clear, as neat is what I feel for successful outcomes. Keeping things simple, and all those simple things should be perfect. Okay, that's it. So don't forget for Swaguna Sampatti, for improving your knowledge and skills in general, overall Ayurveda and dermatology, right? So thank you for watching, and see you again in next video. Take care. Namaste.